Hello, my dear friends. Let's dive into the most interesting and the simplest topic, that is respiratory failure. It is the most common reason for ICU admission. There are 4 types, and I have made a very simple diagram to explain you type 1 respiratory failure. You can see this is blood vessel which has carbon dioxide. You can see this is alveoli which is filled with fluid, and there is alveolar flooding. Oxygen is trying to go in, but it is not able to go. So there is intrapulmonary shunting. Now, due to the alveolar filling, oxygen cannot diffuse through alveolar barrier and reach the blood vessel, while carbon dioxide, being the highly diffusible gas, can leave the blood vessel and exchange through the alveolar surface. The conditions in which we can see the type 1 respiratory failure, the most common I am telling is sepsis, pneumonia, pancreatitis, and multiple blood transfusions. Now, as you have seen that oxygen was trying to go in but was not able to go in, so there was a condition called as alveolar hypoxia. This will stimulate your respiratory center, and there will be hyperventilation which will help the lung to wash out the carbon dioxide inside it. Now, in ABG report, you will see that your partial pressure of carbon dioxide and oxygen both are reduced. Generally, you must be thinking this is respiratory failure. Carbon dioxide should be filled in the lungs, but it is not filled. So there is a diffusion defect. Why carbon dioxide partial pressure is decreased? There are 2 main reasons for it. The first reason is it is highly diffusible gas, and the second reason is stimulation of respiratory center, which is helping your lungs to wash out the carbon dioxide. Now, what are the causes of your type 1 respiratory failure? One is your pulmonary edema, second is pneumonia, third is lung injury, and fourth is alveolar hemorrhage. So let me take you to the treatment part of type 1 respiratory failure, and especially ARDS, acute respiratory distress syndrome. We have to do the mechanical ventilation, in which we have to keep low tidal volume, that is 6 ml per kg. Usually it is 12 ml per kg, but we have to keep it till 6 ml per kg. Then we have to do fluid conservative strategy and proning. Now we are diving to the topic of type 2 respiratory failure. I will take you to the very basic thing, and that is कि ब्रेन स्टेम से मैसेज जाता है मोटर न्यूरॉन पे, मोटर न्यूरॉन से मैसेज जाता है फ्रेनिक एंड इंटरकॉस्टल नर्व्स पे, उससे जाता है न्यूरोमस्कुलर जंक्शन पे, फिर रेस्पिरेटरी मसल्स पे, फिर लंग्स पे, फिर एल्वेलाई और कैपिलरीज पे. तो होता क्या है माय डियर फ्रेंड्स कि कार्बन डाइऑक्साइड बहुत ज़्यादा फिल हो जाती है इन द ब्लड वेसल, बट दिस टाइम देयर नो रिस्पॉन्स इन द ब्रेन स्टेम, योर मोटर न्यूरॉन एंड द फर्दर फ्रेनिक नर्व्स. Carbon dioxide accumulates and remains in the capillaries. So in type 2 respiratory failure, the ABG will be reduced partial pressure of oxygen and increased partial pressure of carbon dioxide. कितना मर्जी यहाँ पे कार्बन डाइऑक्साइड बढ़ रहा है, इनके ऊपर कुछ रिस्पॉन्स नहीं जा रहा टाइप 2 रेस्पिरेटरी फेलियर में. सो हेयर द डिफेक्ट इज वेंटिलेशन डिफेक्ट. इन टाइप 1 respiratory failure, the defect was your diffusion defect. Now, further, what are the causes of type 2 respiratory failure? The mnemonic is COPD. C stands for central causes, that is brain injury, your meningitis, drug like opioids and alcohol. O means obstruction. This is a mnemonic. Okay, O means obstruction, foreign body, tumor in airway. P is your pump, Guillain-Barré syndrome, motor neuron disease, myasthenia gravis, myopathy, polio, ankylosing spondylitis, kyphoscoliosis. Now, when COPD is there are 2 types. One is chronic bronchitis, another is emphysema. In chronic bronchitis, you see type 2 respiratory failure, and in emphysema, you see type 1 respiratory failure. In asthma, if it is mild or acute, you see type 1 respiratory failure, and if it is severe or untreated, you see type 2 respiratory failure. Now, what is the treatment of type 2 respiratory failure? First of all, you have to treat the underlying cause, and second of all, you have to give the supportive management, that is NIPPV, that is non-invasive positive pressure ventilation with tight facial mask, to avoid the mechanical ventilation in this patient. I hope you have enjoyed this video, and I have made this topic simplest for you. Thank you for watching this video.